Board member who wrote this, Dr. Anthony Chen, Director of Health of the Tacoma County Health Department. Regarding the where the curve is, and I know each day you get a board member report that shows the number of cases we have. And you're correct. For about the past week and a half, our new cases have fluctuated around 30 to 45. Today, it's a little bit lower. It's down at 23, I believe it is. Yes, 23. But then we also reported another death. We're getting to that flat point, but we're not past the peak, right? I mean, we're still increasing every day. And hopefully today indicates that we're starting to come down a little lower. And to your point, the King County, Snohomish, are all observing the same flattening pattern. Yesterday, the Institute for, I'm going wrong, it's the joint effort by Gates Foundation and other entities that did a lot of the modeling around this disease, and they basically had published something that showed that the social distancing and all the community mitigation was making a difference. So just by comparison, you know, the effective rate of reproduction, or the RE, at the beginning of this was like 2.3. What they were seeing now is that it's hovering around 0.7, but then the margin of error goes above 1 and goes down, I think, to like 0.23 or something. But what that means is if you're at 1, that means one sick person will make one other person sick, whereas before we were at 2.3, so one person was making 2.25 people sick. So that's really good news. But the other aspect of that is it's still hovering around 1, right? It's a little bit below, a little bit above. So that's better than before, but it's not great. And so they pretty much reinforce the point that if we ease up on the social mitigation strategies, we're going to bounce back up, right? And this is, so the good news is that we're making progress. The bad news is it's like your blood pressure, right? If you have high blood pressure and you're taking your medications and your blood pressure looks great, it's great because you're taking your medicine and you can't stop your medication. So I know I was on a call just before this one where they were asking, so what about, the events people had planned for the summer, like Freedom Fair? A lot of nonprofits have fundraisers still going on if they hadn't already been canceled. And I think the likelihood we're going to be able to have those large public gatherings is probably low. So, so the good news is that the rate of increase is flattening. The curve is, we're not past the peak yet. And, the not so great news is that we've got to keep it up, right? I mean, people are doing a really good job trying to observe these restrictions. But coming back to what you were saying about I think you called it strategic planning. If we use kind of ICS talk, it's more about we're starting to plan recovery, right? The acute event, not to say COVID-19 has gone away, but the kind of the overwhelming chaos we had and that we had to respond to, it's down at a much more manageable level. We're now talking about what are we going to do now that we've reached this kind of plateau, or we might be going past the peak. Because if we don't prepare for it, and we either loosen up too quickly and things bounce back, or something else happens and we get say a bunch of new cases come in out of state or something, then we're going to go right back up. So we believe the key to this is that we need to really be able to step up testing, which will mean that our positives will go up. But then what we want to be able to do then is also increase our capacity to do disease investigation, contact tracing, and support people in isolation and quarantine. This is how countries around the world that have been successful in truly flattening the curve have done it, right? So this is where Singapore, Hong Kong, and Taiwan were able to keep their cases very low. They never really experienced big spikes until more recently, where they're now seeing importation from other countries. This is what Korea did when they had the huge initial spike, but then they flattened the curve. Very aggressive testing, aggressive disease investigation, contact tracing, isolation, quarantine. So there's actually going to be a call later this evening with Department of Health talking about trying to stand that up. There are estimates that, nationwide, we're going to need to have several thousand more disease investigators. Not sure how many we will need in this area. I think yesterday, King County threw out a number of several hundred. Considering that we have 280 employees, adding, a few hundred in Pierce County, or even adding 100 in Pierce County is a daunting task. I know Nigel and Stephanie might be able to speak to this a bit, but Nigel and Stephanie have been working us on that planning. I believe that they're standing up a volunteer MRC, Medical Reserve Corps, disease investigation team. I've asked them to develop a plan to more aggressively do this. We are looking at things such as, are there innovative ways for us to look at, to do some of this work, such as, mobilizing existing technology like hiring call centers to do this. There's been talk about, I believe Massachusetts went out and recruited a bunch of volunteers and got them trained. There are also software technology that already exists where we can, that's being used in some places for people who are taking medications for 6 to 12 months, where you can chat with them, you can video observe them taking medication and so on. So that to me is where we need to focus our planning right now. There are also conversations going on. You've probably seen that the 3 Western states, Oregon, California, and Washington, have agreed to collaborate. But the difficult question is, what are you going to open up? And how are you going to keep a lid on things? And how are you going to monitor the progress? So all kinds of conversations that need to be had about, do we continue to look at case counts, which if we really do open up testing, the case counts will have less meaning because we're intentionally testing more people. Are we going to look at deaths? And how frequently should we monitor these data? You can imagine that if we did this in a really scientific way, we would do one intervention. We would use certain criteria about who we liberalize the criteria for, wait maybe 3 weeks to see what the effect of it is. If it's still well controlled, then maybe we move on to the next step. That's kind of ideal, but we need to have those data systems in place. We need to have the tests available. We need to have teams ready to do the disease investigation, contact tracing, and so on. And I think just to put in perspective, right? I mean, we've got 1,000 cases. That's like 0.1%. So, 99% of our population is not immune to this virus right now. That's a lot of people we need to get immune before we can say we're going to throw the doors open to having big public events and letting people go back to normal. So, until a vaccine shows up, right, we just got to do it in a very controlled way. I think those of you who have been paying attention to our reports of death also, the deaths we've had most recently, they're all elderly people underlying medical conditions and living in congregate care facilities, right? So that's why we've been also, I don't know whether you caught it in Stephanie's presentation, investing a huge amount of effort right now with our healthcare partners. We have drop teams going into these long-term care facilities. If there are concerns, we go in, we test. If they're positives, we may be testing the whole community there as well as the workers, working with them on infection control, cohorting, so on and so forth. But we've got to stay on top of that group or if we want to avoid getting another life care center here. So I know not real clear answer for you, but Board Member Hirota, I think that gives you an idea of where we are thinking, where the state public health is thinking, and hopefully that will inform the plan that's going to come out for the West Coast.